And this is going to be, oh, yes, okay, sorry. Welcome. This is going to be an action-packed panel with lots of great ideas and discussions. We want to spark your imaginations about what might be possible, point to, gaps that we see, and generate discussion. So we want to know kind of what is happening across the country based on the different safe spaces that we're aware of. So this panel is really going to give you a sense of some of the different models that exist, the kinds of challenges that they are experiencing, some of which will be of no surprise to anyone, but also how they're shifting their shelter models to fit the needs of communities, changing the culture around ageism, how to address that in order to support prevention, and the need for culturally sensitive and increased linguistic challenges that people may be facing. So it is going to be a good hour together. I'm really looking forward to it. And so I'm going to start with Marianne, and Marianne's really going to start by describe your shelter, the model, the role that you're filling, the kinds of limitations, maybe the number of people that you're serving. Are you urban? Are you rural? Those kinds of introduce us to yourselves. Thank you.
Hi, everyone. Welcome. I'm coming to you from beautiful Calgary, Alberta. It rained overnight, but it's looking good out there so far today. I just wanted to share with you about our elder abuse shelter that we have in Calgary. Of course, it's rural. I have a bit of a PowerPoint here just to kind of see, so you can see what our rooms look like. So for us, 55 plus, and clients have to be actively fleeing elder abuse. We have 14 funded beds in this beautiful shelter that hopefully you can all see right now. We are fully funded, and we are always full. So what does that tell you? It tells you that obviously there's a need for shelter for older adults escaping abuse, and that requirement for assistance and help so that they can move out into the community and live successfully in the community. So we have weekly case management at our shelter with social workers. So people look at, sometimes it's we're going right back to the basics around getting ID, getting an Alberta healthcare card, before we can even look at housing options to fill out the forms and get seniors housed in the community. One of the struggles that we face is that, like a lot of places in Canada, or probably most places, is that there's a housing shortage. And so we are having difficulties placing our seniors in the area because of housing not being available, housing costing too much money, that type of thing. So normally we're 90-day shelter. But with the new struggles nowadays, we're looking at sometimes 6, 7, 8 months of individuals in shelter. Last year, we had 37 admissions for the year. We turned away 82 due to capacity. There was probably around 300 that we turned away due to didn't meet mandate or individuals that we didn't have the resources to support, so that type of thing. Our average age is 66 years of age. And one of the questions that we were talking about is whether, our population really reflects the population of Calgary and Alberta. For us, we have about 16% of Indigenous clients accessing the shelter, and I think it's 1.9% of Indigenous 2.9%, sorry, of Indigenous folk that make up the greater Calgary area. Longer stays, like I just finished saying, and clients primarily come to us from within Calgary. However, we do have clients that come from rural Alberta. We have clients come from BC, from Ontario, from other provinces, just due to the fact that there is limited elder abuse shelters in Canada. Alberta is doing a pretty good, we're doing a pretty good job in terms of elder abuse. We have a shelter here in Calgary, and we also have one in Edmonton. And, you know, even further to that, we're working with the government right now to develop safe spaces for rural and Indigenous communities in Alberta. So what that means is we're trying to partner with nursing homes or other long-term care senior centers in those rural and Indigenous communities to secure maybe one bed, so that individuals don't have to come to the urban centers for that type of support. You know, when we talk about our limitations and challenges, our shelter does not have the capacity to work with individuals that have high medical needs or don't have a level of independence where they can make their own food, take care of themselves in their own room, access supports independently in the community. Sometimes we partner with home care, but sometimes that independence piece, we don't have those supports. We don't have healthcare aides. We don't have doctors or nurses or mental health professionals to help us within the shelter. So what we do is we make partners and relationships with people out in the community so that we can access that, but right in shelter, we don't have those supports at this time. Substance use is another one. So we want to, you know, for all of our seniors to be able to be safe and secure. We do not have the ability to work with those individuals that have, you know, substance use and that is affecting their goals and their day-to-day. And then of course, the last one here is housing crisis and cost of living. I'm also making sure that I'm checking my time here because I know we all don't have lots of time. In terms of our strengths, we have for up to 1 year after people leave shelter at Unison. We have 2 social workers that will work specifically with clients in the community to maintain their success. So, and it was interesting because I had a large get together through accreditation probably a couple of weeks ago. And we had a number of past outreach clients that came to join the celebration. And and I know this is anecdotal, but a number of clients and just the vibe of, you know what, Marianne, we were at the shelter and then kind of out in the community and somewhat lost in a way. And so that partnership and that being able to have that past for 1 year post shelter, that they can have somebody that they can call, that they can get assistance from, get resources from, has helped them immensely to not return back to shelters, to not return back to homelessness, right? So that's super important. I was very excited to hear a lot of those stories and whatnot from our seniors to know that the service is doing well. And I do have a story, but I think what I'm going to do is I want to make sure everybody else has time to explain their shelter, and then maybe we can go in some of those other stories afterwards if we have time. And if anybody has questions, there's my information.
Thanks, Marianne. I don't want to forget about the story, so we'll come back to it. And so does one of the other panelists want to volunteer to go next? Or I'll randomly select. Go ahead, Karlee.
I can go. Hi, everybody. I'm Karlee Grant. I'm the Senior Programs Manager with Victoria Women's Transition House, and we are located on the Wasanic, Esquimalt, and Sankey Nations, colonially known as Victoria. And today I'm going to talk about 2 of our programs that we offer that are specifically for older adults. Our first one is our Safe Home, and our Safe Home provides emergency shelter for individuals 50 plus that are fleeing intimate partner violence. And our secondary mandate is those that are fleeing abuse from their adult children, recognizing that there's sort of that intergenerational component to abuse. Now, within our agency, we currently only have one space, which is a little bit shocking given the size of our location. Luckily, we are moving to have 2 more additional safe home spaces opening in the fall. So I'm very excited to be able to offer that. So what this space offers is, instead of an individual 50 plus staying within our emergency shelter for 30 days, we provide them with a space that is of more independence, more a space where they can be by themselves, knowing that a shelter space can be overwhelming with children running around, that there might be additional needs around privacy if they do come with home care supports that they need for aids to daily living, but also allow them additional. Shelter is a maximum 30-day stay, because our purpose is to support those fleeing violence. And the highest risk state is within that 30 days. But we recognize that individuals that are 50 plus may have more complex needs that we have to address and provide more time. It might be harder to get back into the workforce. There might be more financial needs. We see a lot of individuals who own property, therefore aren't eligible for certain housing, but that's being used as financial abuse by their abusive partners. So we do provide up to 60-day stay in this space. The space does have to allow for individuals who are not being actively sought. So the risk level of the violence has to be lowered. With this, currently this past year, we only provided safe spaces to 6 individuals because we were at capacity, and turned away 11 individuals. So that's really showing the need of that space. Some of the reasons we've had to turn away individuals from that program was that around that healthcare needs and the higher level of healthcare needs that we can't support, or accessibility. The building that this location is housed in isn't quite as accessible as we would like. So that creates an additional barrier. Our new location that will have 2 additional safe homes does have an accessible unit. So we're very excited to be able to provide that opportunity to those fleeing violence. The second space is actually a transitional housing unit that is up to 2 years for individuals fleeing intimate violence, and provides them a 1-bedroom unit that they can rent at rent geared to income for up to 2 years while they build and regain independence, both financially and within their goals, and go through healing. Now, last year we served 29 individuals through that program, and unfortunately we still have a wait list. So there's not enough spaces for that specific population that we're serving. And unfortunately, in our safe home, only about 50% of the individuals we served last year actually found permanent housing. The rest we had to transition into a different shelter or temporary housing, which is very unfortunate. But as I'm sure everybody on this panel will note, is the cost of living right now is so high that there's, even with subsidies, many individuals cannot even afford to pay rent. And never mind the lack of actual accessible and safe housing for the individuals we serve. The question around if it reflects the diversity of the local population, I think we don't have enough spaces to be able to represent the diversity of the population. We are finding we are serving a lot more newcomers to Canada, or those seeking refugees status. And so we have had to adapt how we provide support, and are providing translation services so that we can provide full support and help people transition and work through the system of gaining independence and finding housing while they are here with us. The strengths of our model is that we do have some ability to adapt. So the one program for our third state transitional housing has previously been sort of high threshold ceiling of age 65 as our top age, but we've been actually adjusting that given the need and the applicants we're seeing. We're seeing that that is moving upwards, that 70s are looking to flee violence and looking for a safe space. So we are adjusting our mandate to be able to meet the needs of the community. So that's a great strength of our program. And I think with the program, it's just like many people on this panel will probably say, is a lack of resources and funds to be able to continue to support and actually meet the needs of the community. We are constantly running wait lists. We are always trying to find creative solutions to get people into housing to continue to heal, but that's not always the case. Unfortunately, we're in a situation that there's a lot of barriers to these individuals moving through sort of that transitional process of housing. So thank you, everyone.
Thanks so much, Karlee. Lisa, I'm going to come to you next.
Hi, good afternoon. My name is Lisa Manuel, and I work at Family Service Toronto in Toronto, Ontario. And we operate as elder abuse or an elder shelter, I'm sorry, called Pat's Place. Just to give you a little bit of background, because sometimes people wonder why the name. So Pat's Place is named after a former manager at Family Service Toronto, who was instrumental in working with the Mayor's Committee in 1984 and onwards in Toronto to recognize that elder abuse was an issue. And so we wanted to honor her name, and that's why it is named Pat's Place. It was also a good name because it was a bit generic, we thought. I'd love to tell you that Pat's Place is big and has lots of beds and all that jazz, but it does not. We rent a 1-bedroom apartment in a confidential location in Toronto, where one person or a couple, because it's a 1-bedroom, can move for up to 60 days rent-free to be able to get away from an abusive situation, to think about what they want to do. We do safety planning with people. We engage them in counseling supports if they wish to be engaged in counseling supports. Not all people will make use of that. We really work to help them slow down the situation that they've found themselves in and to get that time away. Of course, Toronto is a very urban environment, and the people that we work with reflect a full range of diversity. We have both men and women accessing Pat's Place who are experiencing abuse from their spouse or partners and or their adult children. We're also very proud of the fact that Pat's Place is pet friendly. So if someone has a pet, they can bring it. And the landlord has a pet friendly policy. Obviously the cat or dog, I guess let's put it that way, needs to be under the control of the owner in public spaces. But that's been a real bonus because we know that people make decisions to stay in the abusive situation that they're living in because they don't know what will happen to their pet. So that's one thing that we're very proud of. Pat's Place opened in September 2008, and we were approached by a member of the Rotary Club of Toronto who actually was in the business of, had a business providing support workers on a private for pay basis to individuals, and knew that there was a group of individuals in the community that couldn't pay for those services and or were not eligible through the public system here in Ontario. And so really came to us saying, and knew that abuse was occurring, and really came to us and said, what would it take to purpose build a shelter in Toronto for older people experiencing abuse? And we sort of took a big gulp and said, we don't think we're ready for that yet. We're not an organization that does bricks and mortars. As we say, we provide supports within the context of housing and other things. But this person stuck with us and managed to secure at that time $35,000 in funding to span across 2 years for us to open Pat's Place, which meant a very large shopping trip to several stores in Toronto to buy everything we needed to equip the unit. And I tell you that story because it has been a shoestring ever since. We've never, unfortunately, been able to secure funding for Pat's Place, despite trying. And so I'm very fortunate that I work in an organization that saw the benefit of it and has been through various means, we're able to pay the rent each month for Pat's Place. The staffing resource supports that we put into Pat's Place come from our seniors team that does a lot of work around working with seniors who are experiencing abuse. People can stay at Pat's Place for up to 60 days. We cannot afford for people to stay beyond that time because we are the leaseholder on the unit. And it makes it very difficult if someone doesn't leave, because the longer they stay, the longer the potential is they're not going to leave, unfortunately, and we're going to be left holding a lease that can get really quite mucky. Of course, if someone has a place to go and needs another week or two, and we're happy to extend our stay, but we cannot extend the stay past 60 days, which makes for some difficult decisions that have to be made to support, but also some really great support that comes from the folks that we work with in the community. So that is one of the successes I wanted to talk about. Pat's Place couldn't work if we did not have strong partnerships with the organizations that refer people to come to live at Pat's Place. So Pat's Place is a planned move. It's not a situation where someone can come in the middle of the night. We don't have housing, we don't have staffing, but it's a planned move. And so we work with community partners who might be working with an older person who is experiencing abuse. And we work together with them to support someone to move into Pat's Place. So if you can do the math, if you can stay for up to 60 days, we have provisions to have about 6 people a year move in and out of Pat's Place. And we probably have at any one time 4 times that number of people for every 2-month rotation. We've got 4 people trying to move into Pat's Place. We don't get a lot of information about the disposition of the people who can't move to Pat's Place because they have to move on to look for something else, which is a difficult situation. But the fact that we do have partners who are willing, and many, you may know this business, many people work in catchment areas, but they're willing to step outside of their catchment area to be able to support the client that they're working with to move to our location, which might not be in the area that they generally work in. So we've developed good and strong relationships with a lot of providers and are always open to new folks coming to talk to us about Pat's Place. The different supports that we offer, I already mentioned a few of them, is sort of safety planning around both being safe moving to, being at, and leaving Pat's Place. We will offer people counseling supports if they are interested. We do provide people with referrals and helping them liaise directly to a range of community resources, and that's done in collaboration, often with the organization that's supporting them. And we start from day one, or as soon as a person will allow us into their lives, and I'll talk a little bit about that, by developing a plan for them, to what they're going to do in the future when they leave Pat's Place. And going back, it was very interesting because when we set up Pat's Place, we were all like gung-ho, we'll be there holding your hand from day one, even before you walk across the threshold. And what we've learned repeatedly in the almost 20 years we've been operating Pat's Place is that people don't want us in their lives when they first get to Pat's Place. They want that time to settle, to close the door, to be able to take control over their location, to do a little exploring in the community that they now find themselves living in. So that's been an interesting and key learning for us, is that we don't sit back and wait forever, but we do, really create that space. And again, that's about creating that sense of safety for individuals. So I think that's about all I have right now about Pat's Place. We'll come back to some storytelling, I hear, Margaret, so I'll turn it over to the next person.
That's great. Thanks so much, Lisa. And so Tiffaney, I'll come to you.
Absolutely. I'm going to share my PowerPoint here. All right. Can you see my PowerPoint?
Yep.
Wonderful. So I'm Tiffaney Pass. I'm the team lead of social work here at A&O Support Services for Older Adults, formerly known as Age and Opportunity. So at our agency, we support older adults 55 plus living in community. And one of the programs we offer is called our Safe Suite program. So this program is safe housing for individuals 55 plus living in the community, regardless of gender. We're able to help both one person or couples in our suites. Our safe suites are furnished accommodations where clients can stay there for up to 60 days free of charge. We do offer a bit of a longer accommodation if needed. Right now, we're seeing about an average stay of 70 days. As everyone else has mentioned right now, one of those challenges is the housing crisis across Canada. So our Safe Suite has 2 locations in the city that are in apartments 55 plus. Nobody knows where those locations are until you're working with the clients. So we do our best to ensure that they are kept confidential at all times. To date, we've had 92 occupants in our suites. So because our Safe Suite only has 2 locations, there's always someone waiting to go into that suite. We do our best on our intake process to ensure we're targeting the right audience, but that can be challenging. So how does it work? How do you get into our Safe Suite program? So clients can self-refer or another person can refer a client on their behalf. They'll go through an in-depth intake assessment with our intake worker and then with 2 social workers to ensure that this is a good fit for them. When clients are in our Safe Suite, they need to be in imminent danger. So they need to leave their situation immediately for fear of their life. With that, we do not work 24/7. So we're only staffed Monday through Friday, 8:30 to 4:30. So if a situation arose on a weekend, we wouldn't be able to get to those people until Monday. In the suite, clients must live independently, so they must be able to cook and clean for themselves and do some light housekeeping. As I mentioned, because we only work Monday through Friday, 8:30 to 4:30, our suites aren't monitored. So we want to make sure that clients are going to be safe in those suites. And maybe that's, working with other organizations to ensure that they will be safe in our safe suites. Who can access our suites? So anyone across Manitoba can access our suites. I think it's really important to be able to hit such a broad population because if you think of someone on a reserve, where would they go safely to hide from their alleged abuser? If they're going to stay with a relative or friend, it could be possible that, the alleged abuser knows where they're going. So we've worked with many people across the province, working on getting them train tickets or bus tickets to get into our suite. When in our suites, clients work with a registered social worker to provide intense counseling services and safety planning. So we really want to make sure that clients have the time to come up with a safe plan for when they leave the suites. We do our best to offer the counseling service. We don't force anyone into counseling if they're not ready for that, but that support is there if they choose to accept it. We also provide practical assistance. So that could be arranging financial support, such as financial community counseling, finding them housing, maybe working through the legal system. Our social workers at A&O are all protection order designates, so we are able to help clients apply for a protection order as well. And any other support that might be needed, such as accessing a health card as well. When in our Safe Suite, we have a partnership with our Winnipeg police. So police are notified when an individual enters our suite. We do that so that if the alleged abuser calls the police saying that this person is missing, they are aware that they are in our suite and are actually not a missing person. So that doesn't go out. We work with our Winnipeg Regional Health Authority as well to ensure that clients are able to live independently. So maybe that's setting up some home care to continue to live independently. Maybe when they came into our safe suite, they were reliant upon the alleged abuser to help with medications or bathing. So we want to make sure we can keep them safe and living independently. All our suites are also equipped with a Victoria Lifeline. So clients are able to wear a lifeline, and if they do have a fall, they're able to press that to receive immediate help as well. Like I said, we make referrals to Winnipeg Police, hospitals if needed, and other abuse shelters. Since we do only have the 2 locations in Winnipeg, sometimes we have to work with other shelters in the city to ensure clients can leave that abusive situation. Some of the challenges we have is, like I just mentioned, the demand of our safe suite. Since we only have 2, sometimes we have to get creative and find other accommodations for the time being until we can move them into our safe suite. We've been able to work with local hotels before to make those accommodations if possible. Another challenge is finding accommodations for clients after they leave the safe suite. Like Lisa had mentioned just earlier, finances are hard. Housing is really high right now. And just the shortage in Manitoba is crazy. It's really hard to find someone a safe space to go after. Another challenge we run into with our safe suite is how are we going to get those clients' belongings from possibly the alleged abuser's house? Our Winnipeg police are very busy, so we might not be able to rely on them to help us with that. So how can we get their stuff so that they can live comfortably in their new place with their own bed and their favorite chair? So really working with clients in that way. Some gray areas also can be a challenge. Like, what if clients don't fit into our services particularly, but need additional support? So what happens if they come to us with addiction problems? They wouldn't be granted access to our safe suite at the time, but how can we ensure they're being safe, and where can we help them get additional support? I think some of the success in our safe suite is, we allow clients to have that time to breathe for a second. They get at least a week before we start, working with them more in depth to just take a second, breathe, relax, and feel safe again. They get the time to explore their surroundings and really get time to know the neighborhood that they're in now. And because they're going into a block that's 55 plus, we've noticed a lot of our clients are able to make friends in the building, which is really nice. Or if they're not social in that way, but they're wanting social engagement, maybe we connect them with one of our other programs at the agency, like Senior Center Without Walls, so that they can have those friendly conversations safely in their own home. And I think that's it. I definitely have stories for later, Margaret, but I'll share those when that time comes.
Okay, thanks, Tiffany. And Mohamed, you are next. Please do introduce yourself and tell us all about your work in your safe space.
Would you like me to share my PowerPoint? Okay. Hello, everyone. My name is Mohamed Abdallah, and I am the founder and executive director at Connections for Seniors. We were established in 2018 with a mandate to empower seniors to overcome barriers to safe and affordable housing and provide support services that help reduce risk to well-being and promote quality of life. We believe that all seniors have the right to feel safe, to feel healthy, and to make choices about their own lives. I can do better with that slide as well. I'm trying to make it just full screen. We were established in January 2018, and our emergency accommodation was attached to case management and other services for older adults 55 plus that are facing homelessness. We started with the vision of having different programs. This is just an oversight of the programs that we are currently providing. But when we first started, the only program that we started was a shelter program. We have 4 adjacent homes or houses located in downtown St. John's area. Can accommodate 16 individuals. We started with 4 beds in 2018, and then we doubled that in 2019, then we tripled that in 2019 as well. So within 2 years, we moved from 4 to 12, and then 2 years after, we have 16 individual rooms for older adults to reside there. It's close to amenities and a lot of services downtown, so it's very convenient to stay. The home has only 4 people at capacity, and then every other home has 4 people. They have their own common area, they receive their meals, and they have a large dining area there. They have access to entertainment and TV and computers in the common areas. Of course, the shelter is staffed with support, case managers and social workers in the daytime, and support workers around the clock, 24/7. And there's the basic need of like housekeeping and other needs that seniors might need staying in a shelter. They'll be receiving. This month, last year, we were approved for 35 individual beds to expand our shelter, as our case managers in the community and the outreach program are working with seniors around the city in multiple shelters. So we thought about bringing seniors in one place under the expansion of the shelter program. This is a historical house in downtown area too. It's about 2 minutes away from the current shelter, but the idea is that it's going to be a housing center for seniors. It will have drop-in services and more housing services in place for seniors when they are in need of support. And instead of moving from a place to another around the city to access services, we're trying to centralize the housing services for seniors in one place. This is meant to be for short-term stay only, from 1 to 3 months. After 1 month, there will be different approaches in why there is no solutions. And then after 3 months, it will be considered a transitional housing needs if the need is not related to the shortage of housing in the community. After COVID, we are seeing a big shortage in the housing market. We're seeing a lot of seniors that are trying to access safe housing, but they are not able to do so due to the cost of living and the increased cost of living. The current shelter space is supposed to start operation in about 3 weeks, and we'll have more intensive case management on site. We usually have about 15 per caseload, and we're gonna decrease that to about 8 per caseload. So we're gonna increase the capacity of case management in order to support seniors in our community. We're fully funded by our provincial government. So there's a lot of work that we're trying to bring up to speed here with the need that has been happening since COVID. Our case management program is a wraparound service. It's housing first approach, but we have a housing team that is focused on that, but it's overlapping with our health and community. We don't separate them, but we separate them on our end, but we don't ignore it when seniors are staying in our shelter. We try to look at all their needs and try to meet them, but housing is a focus when they are staying in a shelter, and they can be referred to some of our other programs that we're operating. We work, a lot of seniors come through our door, don't have ID, don't have a family doctor. The story I'm going to be mentioning after for actually a specific situation of a senior that was being evicted due to health concerns, but it was perceived as a behavior issue. Until 2 years after when we started, we met him. He was one of the first people that came through our door, and everything got situated within 4 months when we discovered what's going on. But having that scope of like holistic scope of approaching seniors' need and looking at all the needs equally, it helps us to figure out what the housing problem is in the first place. We receive, excuse me, our main referral agency is Newfoundland Labrador Housing. They are the government department that oversee emergency housing and approve shelters for individuals to stay in shelters. And we fall under that as well. But we also work with, now the number is a little bit bigger than that, but on average about, I think 30 different agencies that work with seniors in different capacities. So we get referrals from a lot of places around the province, as we are the only like seniors focused shelter in the province. We get a lot of referrals from our hospitals. It's whether on consultative like approach or a request to discharge to our shelter due to an eviction from a personal care home, or people can lose their home for any reason, end up in the hospital, and then we're being reached out to in order to figure out a solution for older adults in order to find a place to stay and help them find a place after the shelter stay. We also work with our hospitals through our housing team to help with the continuum of care post-discharge. So some seniors would need to be discharged in the community, and we work with them in maintaining housing in the period after the hospital, as we found a lot of cases that when people get discharged from the hospital due to the health needs and other needs, they end up being homeless and losing their housing for various reasons. This is out of the shelter, but we believe it maintains housing when there's access to healthcare services through case management and support. So our housing team worked very closely post shelter discharge with individuals in order to make sure that they are safely housed and their needs are being met while in their housing. And we have seen a lot of situations before that program existed of seniors deteriorating health-wise and end up being homeless. Then the shelters start to act as a healthcare facility, which we're not prepared to do, and it ends up being in the hospital eventually. So we do a lot of work in the community to maintain housing, but from a healthcare perspective, in order to avoid the shelter stay or post-shelter stay, in order to maintain the housing arrangement that the person had secured. Transportation is a big piece of that work, and it was actually one of the first services that we provided with the shelter. We provide transportation for housing, health, finance, and food security reasons to our shelter clients. So people will be able to, while they are arranging for to move out of the shelter, we try to access the other services that will help them maintain the housing arrangement after they move out of the shelter. We help securing family physician. We try to assign a pharmacy that will be close by. Sometimes there's regular appointments like dialysis and cancer appointments that they don't qualify for any kind of medical transportation here, especially if they're over 65. And we work with them in order to make sure that they have access to that service. Also, a reduction in ambulance calls. Sometimes we have had situations that seniors call the ambulance every second day and sometimes every day. And having a family doctor and having transportation that they know in the morning that they can go to the hospital or see a doctor, that will limit that kind of service usage. The housing options that we have usually are between personal care homes, community care, long-term care, and those are institutional housing arrangement under our Newfoundland Health Services. Then it comes to the private market, which we saw a lot of shortage in the last couple of years. And also there's a lot of stigma around individuals that are being supported by community agencies in general with different age groups, which led some of the big housing providers, private business housing providers, turn away seniors and others from using or renting their properties. There's a lot of work now in the community to try to look into affordable housing and other forms of social housing, so individuals can avail from them. Precarious housing is something that we also see a lot with bed settings, and it's something that we try to advocate for, as we are seeing a lot of seniors don't have a choice, especially when it comes to affordability, than to live somewhere that is not adequate for their needs or their age, or for anybody sometimes to be living in places that are precarious. We also try to work with families in order to bring people back to their homes. So we had situations that people went out of the shelter back to their homes or with their family through mediation and family reconnection. We find a lot of challenges to living independently. In a nutshell, their accessibility is a big piece of it. We have very limited accessible options in our city here and in the province overall. When things were built 50 years ago or 60 years ago, a lot of it, accessibility was not kept in mind for various reasons, but now we started to think accessibility as a community and try to be age-friendly city and age-friendly province as we move forward. Personal care needs is a challenge when it comes to mental health behaviors and the shortage of personal care workers here in the province. So we see it on too many levels. It's a challenge in the shelter system as well. A lot of personal care agencies doesn't go into shelters due to safety, and we try to work with our healthcare system here in order to see how can we provide that service through the agency or the organization versus working with a third party and limit that liability. There's a lot of these challenges leads to older adults being homeless and facing homelessness. And we have seen a lot of unsheltered situations because of individuals cannot maintain their household, or the roof is leaking and they cannot live there anymore. The death of a partner and they cannot pay the mortgage anymore, and so on. There's small needs for like medication reminders, need for like healthy meals. A lot of individuals are not used to the reduction that happens in their income sometimes, and with the food costs going up, it's very difficult to maintain a balanced nutritional meals. So it ends up being affecting their health. And we work on that as well to be able to connect them, whether transportation for groceries or delivering meals to their homes. And now we have like a Meals on Wheels kind of program that help them maintain their housing and receive meals at their home.
Mohamed, can I interrupt for a minute?
Sure.
I had a question about the percentage of people that are fleeing violence that are in your, like, you're covering it seems like quite a broad swath of people. Do you have a sense about what the percentage is of people who are fleeing violence?
It's roughly about 20%. Yes.
About 20%. Yeah.
It's a different form of violence and abuse in a lot of the situations. And
yes, it is.
Most of the time, there's no insight for that violence exists. So a lot of it happens a lot from family members, and it's related to finances most of the time as well. I would say 90% of the time is financial related, and about 85% of our clients are men, and actually about 80% in the community in general that are facing homelessness in the community here are men. Men are overrepresented in the homelessness data
Yes.
that we see.
The structural violence is an important part of the conversation, isn't it? Yeah.
It is, yeah, for sure. We see a lot of older adults that are currently hospitalized and occupying acute care beds. They miss the essential services in the community, and big part of it that, again, they don't have an inside self-reporting during the assessment doesn't always reflect what's really going on, and part of it is violence, and part of it is what is the real situation of what's going on. And again, the story I'm gonna share is gonna be part of that, elaborating on that a lot. Our goals is to look into offering affordable housing. We are now developing like 60 units affordable housing complex in order to be able to meet the big needs that we have in the community. Seniors in the community now are roughly about 35%. I mean, in the homelessness community now, or the individuals that are facing homelessness, is reported to be about 35 to 40% sometimes, which is very high. And we were successful last year to secure some funding in order to develop more affordable housing units. We partner with our province and city. 3 of us came together to offer supportive housing. And we were able to have 12 individuals that have been housed for the last 4 years. We're looking now to expand on that because there's a very high demand on that sort of housing. A lot of the supportive housing, actually, it's about, I would say, roughly about 50% of the individuals that are staying there escaped violence at some point and ended up with us. So staying in such a housing unit, first of all, it helps with social isolation. So it eliminates the idea of them being alone while any sort of abuse or any sort of violence happens. There's also the absence of not being aware of their finances is something that we help to eliminate. So we keep them on the top of their finances. We work with them in order to make sure that they know what's going in and what's going out.
That's great. Maybe we can move back to the panel, and like, you've raised some really interesting questions for me anyway, and we can bring the discussion. Was there anything else that you wanted to add before we go back to the panel?
Nope, that was the last one.
Perfect. Okay, that's great. Thanks so much. It's amazing when you have the province and the municipality working with you. So this is so I do want this to be more of a dialogue. I have questions. I'm interested in this. You've been meeting as a group for a while now and expressed interest in coming together because your work is you're kind of isolated in the work that you're doing. Why do you think it's important for us to have a forum like this? Are we talking about what we should be talking about today? We're introducing people to the different models. I'm just interested in any thoughts you have about why this conference is important.
Well, if I can go first, I think this type of conference is really important to shine the light on the fact that there is elder abuse happening in our communities on a daily basis. It's very interesting to me when I talk to people about what I do or what I'm passionate about, and people are, what do you mean that happens? Yes, it does happen. We need more presentations, we need more awareness, we need more buy-in in terms of collaboration with other agencies so that we can address some of these issues. I also see that we really have a changing landscape in Canada. You know, and we're seeing that specifically at the shelter in terms of elder abuse, is that, you know, all types of different individuals from different countries, different cultures, different backgrounds, and really having to adapt in terms of language, in terms of practices, in terms of how we run the shelter. You know, we're always taking a look at, you know, we have people that don't speak English at all, and trying to even find those interpreters to be able to converse with individuals is very difficult. Even if we only get a translator once a week to do the case management piece, this is daily living. And so the last thing in the world that you want to see is that people feel isolated because of their language or because of their own cultural practices and whatnot. So you know, for me and myself and our team here, looking at those, you know, having those safe spaces for cultural activities, having those understanding and acceptance, and that people feel welcome. You know, I do have to say that we have an individual here that, or had an individual that is illiterate and doesn't speak English at 70 years of age. And I thought that maybe she would feel more comfortable at the Muslim shelter here. After 2 weeks here, she said through translation, absolutely not. I love it here. And it's interesting to watch. It's, you know, with the other clients, embracing individuals. And even if there's no language, we do a lot of hand movements, we do a lot of charades and can get the point across. And this individual did feel comfortable. And so that's great. But I think that the landscape is changing and we need to take a look at that and adapt. You know, I think, was it Karlee or Tiffaney or somebody said, adapting and being creative of how we deliver service and that continuity of care for our clients. That's my
Thanks,
piece.
Marianne. Yeah, thanks, Marianne. Lisa?
Yeah, for me, it's been a real learning experience to learn about all the different models that have happened across the country, and to know that it happens differently in different provinces. And so hoping that some provinces can build on the work of other provinces that are ahead, and hoping that for those who are interested in setting up some kind of safe bed, the best advice I ever got it was just do it. Do it and figure it out as you go. And so, and I realized, you know, I did have a small grant to get started. But even when that grant ran out, it was to continue to find a way to make it happen. So that would be my best advice, is if you're interested and passionate and want to make this happen, then you can in your own communities, and you'll do it in different ways in different parts of the province that you are in, or different parts of the country, because there's different networks of people out there that are all focused and interested in this area.
Yeah, thanks. I heard that over and over again with the speakers, the sort of the passion with which people are creative and working, you know, without really any kind of secure funding, but coming up with amazing solutions. It's really testimony to your commitment to the issues. Anyone else?
I think too, it's important to remember that each area and province is different. So it's not a one size fits all model. We have to adapt and we have to listen to our clients. So if you're looking to start up a safe space for your clients, they are the experts. Listen to what they need in the community and what supports they need. I think that would be my biggest advice for anyone that's looking up to start a safe space.
Thank you, Tiffaney.
To just go off of what Tiffaney mentioned, is that it is unique based on provinces. We know all provinces are funded differently and prioritized differently, but having come together with this working group, really noticing that there are some themes and trends that we see across all provinces: the lack of resources, the increase of challenges, and some of the creativity that has to come in play because of wanting to be adaptable to meet the needs of the individuals we serve. So that's kind of a piece as well, is just making sure we continue to be adaptable and continue to voice the need for more funding and supports for these services.
Karlee, I have a question for you. But Benedict, this was the time that we allowed, like that we created for people in the audience. If they have questions, put them in your chat, put them in the Q&A, and Benedict will retrieve them. Are there any questions, Benedict?
For now, I'm not seeing any. I think people are probably just still kind of like taking it in and then typing.
Yeah.
So you have a couple more minutes to continue the conversation if you want while we collect them.
Well, particularly, Karlee, I was interested in, your model, and I wondered, are there lessons from the women's movement, the shelter movement that, I was very struck by what you're learning from working with older people in the shelter, but, generally, are there lessons that we can take from the shelter movement?
I think that there is a lot of there's still a lot of stigma associated to violence against women. And
Yeah.
really, especially as we're looking at different demographics who have had to just, it's just the way it is. And that's how they were supposed to adapt within a marriage or a partnership, is something we have to keep in mind as well, because there is a lot of stigma and maybe not as many support. So with that intergenerational component of intimate partner violence, their children may not be safe either. So there's this assumption that there's natural supports in place that they can turn to, but those natural supports are just as unsafe as their partner is. So I think that's a piece is to really recognize that. I think Mohamed mentioned around the isolation, and even if they have family, there is definitely isolation still in place because their family's not safe.
Thanks, Karlee.
We do have a question that came in from Michelle, who is asking the group, when your spaces are full, in particular when it's due to when there's a lack of access to other housing, where do people go who are in need of safety? So when you're keeping people longer, because you can't decently put them out in the streets, but they don't have housing to go to next, what happens for all the other people who are looking for a safe place to land?
We have lots of difficult conversations. Our agency, we try to maintain our time limit and try and find alternate safe space, even if it's a temporary housing, if it's just something we can think of as far as some form of subsidy, even if it's not ideal. We view it as somebody who has to come in. It's around safety and the emergency of it. And so we really do try and keep to that time limit. And it is a lot of hard, difficult conversations we have to have.
Anyone else from
Anyone
the
else?
group?
I can say from here at the Unison Elder Abuse Shelter, we do keep clients for a longer period of time. We find with our seniors, it's a lot, maybe a bit more difficult to move them in terms of their physical and medical needs, right? And so we will keep people on a longer term basis. And we also run the elder abuse resource line here out of the shelter. So we get many calls for shelter, but also just for those safe spaces. So we provide resources to those callers and follow up. We also have an elder abuse navigator through the Unison Senior Center. So we can navigate or hook those people up with a navigator to be able to help them in the community of Calgary. So if we do have to move clients on and there isn't necessarily an apartment for them to go to, it's trying to find like doing a warm transfer and trying to find the best, like you were saying, Karlee, the safe space in the community for them, whatever that looks like. Because it's unfortunate when we do have 14 beds, but with the housing crisis, people aren't moving through as quickly. So we could actually assist more. We're getting there. We hope to get there soon.
I also want to just acknowledge that how difficult that is for staff, right? I think it's really important to acknowledge the people that are providing the service, providing the care. There's an impact on them too, when you're not able to, you know, make a transition, keep a person in shelter. That needs to be part of this discussion, and how do we protect the people who are doing the work as well. And that's a bit of a segue for me too. A few of you had stories. We just have like 5 minutes kind of thing. But I was interested, how do you keep yourself up on it? What inspires you? What are the stories that, make you feel like this is all, as hard as it is, it's really worth doing?
No matter
Well,
what the
I
story
can
is, there's
share-
always success. Sorry.
I can share
Yes.
Dan's story really quick that I was going to talk about earlier. I'll do 2 minutes. So Dan's story is that he was at the shelter 3 times in 2.5 years, returned to family abuse twice because of issues around immigration and the legalities that go around that. 3rd time came, no more legalities, no more issues, and we're able to get him safely housed, and he is glowing, loving life. It's been about a year, and I just can't even imagine. Okay, now I'm gonna start to cry. So anyways, it was just a really good feel-good story that, sometimes it takes a couple of times. Sometimes it takes 7 times, sometimes it takes 10 times, but the fact that we're making a difference even in that 1 starfish life, it's really important. And so that's, I think, what keeps the people up around here and going, you know what, we're doing good work.
Wonderful. Thanks, Marianne. Mohamed?
We have a saying here that if you're not nagging somebody, you're not doing your job. So we have to be the nagger. We cannot be the people that give up. We had a senior that came through our door after 2 years of that we were just established in 2018. He was being evicted from personal care home, about 6 or 7 of them, due to aggression and behavior. He stayed with us for about 4 months. Within those 4 months, he called the ambulance in 1 month over 23 times due to not being able to stand up. We took him, he didn't have a family doctor. We found a family doctor, we got a referral. I remember at the time I was doing the work myself, and at the doctor's office, all his answers was out of pride. I have no problem. How many times do you fall? Nothing, I'm okay. After his consent, we explained to the doctor what's going on. He got admitted for 2 weeks. He got diagnosed with about 13 conditions. Half of them was neurological. I don't know how to say half of them. And he didn't see with one eye. He had Parkinson's, early stages of Parkinson's. He had early stages of dementia, and the behaviors that were people talking about were just part of his condition. He ended up in a higher level of care, housed for the last 5 years, and we still visit him and say hi every holiday season. And when we tell people that, there's always a solution. It's just we need to know what the problem is.
Wonderful. Thank you. Go ahead, Lisa.
Yeah, I just wanted to bring you the words of 2 people that have stayed at Pat's Place. And when we asked them what that means to them, one person said, at Pat's Place, I could lock my door, have a shower, rest. It was so safe. This place gives you a home when you need it the most. For 2 months, everything was taken care of, furniture, basic necessities, and Pat's Place staff would check in on me. I did a lot of thinking while I was there, heaven on earth. The second client said, thank you so much for giving me the chance to spend time on my own and the opportunity to find some of myself again. This is a creative idea for seniors and the one that has so much potential.
Thank you. Thank you, Lisa.
you.
Anyone else?
Yeah, I'll just share one of our clients really relates to having a safe space of actually saving their life, not necessarily because of the abuse, but because of the medical needs that they all the surgeries that were put on hold because they were unhoused, because they had to flee abuse. And so without us providing them that safe space, they weren't allowed to proceed with their surgeries that they needed to be able to maintain a fully livable life, how they wanted to live it. And so I think that there is this broader context too that we have to remember, is that it's not always just about housing, but also medical care that goes along with being unhoused. So this person is now done all their surgeries, fully living their life, and really working now on their goals and healing. So that's one of the pieces that helps us keep going with our knowing the work that we do.
Thanks, Karlee.
We have a quick question from Mohamed from the Q&A box that is asking, what is your staffing contingency?
Staffing has to be struggled between funding and actually needs. It depends on the clientele we have in the shelter. Sometimes we can maneuver that and moving around. So sometimes we are doubling staff or tripling staff in certain situations. And sometimes when the shelter doesn't seem to need the high attention, especially overnight, becomes a single staff for funding reasons. But for the new model that we're having, it's going to be double staff all around the day. And that's our model that we showed our government the need for it. So it's going to be, and we think that's very important to have, but funding can be very challenging, especially with the overtimes and everything else to have. So we have our support staff, we separate between support in the shelter and the housing support. So these are two different things. So to stay in the shelter, you need support in place to make it as comfortable as possible. And in order to move out of the shelter, you need a different staffing model in order to help you moving out. So when I'm talking about single staff, I'm talking only about the support staff in the shelter. That's separate from the case management and the support that is in place. So these are two different areas that we differentiate between them when we talk about support.
Thank you. Tiffaney, I'm going to give you the last word.
Yeah, so just a quick story about one of the clients that I worked with. It was one of my first clients about 6 years ago, and she came in with physical abuse from her alleged abuser. Client was able to go into our safe suite and breathe for the first time in years. She said, well, in our suite, she was able to realize how strong she is and how much resilience she has. Client was able to move into a safe space and is still living there today. She was able to start crafting again, and she's attending local craft sales and selling her stuff, and is just so happy to be able to reconnect with her grandchildren now that she's safe again.
Thank you so much. Benedict, it's actually you that might get the final word. I was just going to thank people for, I've really enjoyed the panel.
All yours.
Yeah, I so appreciate the different stories and the look into your world. And you've also stimulated other things that I think are worthy of discussion. You know, I'm interested in the reduced ambulance calls impact, you know, and I think in ongoing conversations, maybe we could talk a little more about the kinds of implications for communities, you know, in supporting older people who are fleeing violence or other kinds of structural violence that are in there, you know, that are so common. So thank you so much, everyone, for this panel, and we will continue the discussion and the thinking. And I think we're going to take, how long of a break, Benedict?
We have 15 minutes. We've been extending the breaks between sessions so people have more time for more snacks. So we'll see you all in 15 minutes for the last session of the day.
Thank you so
Thank you
much.
so much.
Thanks, everyone.